if you are curious about the science of what is going on when you do foam rolling, stay tuned because that is what we're going to talk about tonight. So I'm Dr. Sarah Sewell from Resilience RX, and foam rolling is the topic of discussion. So we're going to debunk 3 myths about foam rolling. The first is that it's good for recovery. The second is that it breaks up tissue adhesions. And the third is that it improves flexibility. So we're going to start with recovery. So most people think foam rolling is good for recovery, and it sort of is. So this is like a half myth. It's fine for recovery, but the real question is there something better for recovery? Because when you're foam rolling, you're bringing increased blood flow to the area, and that's one of the main things that you need for recovery, right? But with foam rolling, compare 5 minutes of foam rolling your entire body to 5 minutes of dynamic movement, warm-up, stretches, lunges, using a PVC, doing some pass-throughs, actively moving. That's going to increase your heart rate, which foam rolling may, but not that much. But that dynamic movement is going to increase your heart rate much more. It's going to get more blood flow to all those muscles that are sore and achy and tired than foam rolling will. So foam rolling can help with recovery. It's good for recovery, but the real question is what's better? And what's better is active movement or going for a cardio flusher like a 15-minute, 20-minute jog or just spin nice and easy on a recovery bike. Next, we're going to talk about flexibility. So most people think foam rolling is good for flexibility. It's good for stretching, it gets things loose, and it sort of does, but it also doesn't at the same time. So when you're foam rolling, what you're really doing is you're causing pain, right? What I typically tell people when they say, oh, I don't know how to foam roll, what am I supposed to do? I'm like, you find the area that hurts, you do more of what hurts, and eventually it's, in theory, supposed to not hurt. That's the very basic, keep it simple, stupid version of foam rolling. And when that's occurring, that muscle is sending a whole bunch of pain signals to your brain saying, hey, this hurts. And so your brain then decreases some of the inhibition in that muscle. And when you're stretching then, you're able to tolerate a greater stretch. You can move more, you have more flexibility because your brain isn't inhibiting that movement because your pain threshold has changed. So before you do the foam rolling, if someone punches you, you're going to perceive that as more painful than if someone punches you in the same area with the same amount of force. So essentially, you're just tricking your brain and being like, actually, this doesn't hurt. And your brain's like, cool, we can move more. But the changes are temporary. So again, following it up with something active, an active movement, an active stretch, something dynamic, something where you're moving, that's going to get you a better result than just foam rolling. Lastly, I want to talk about tissue adhesions. And I saved this for last because I'll get a little bit nerdy when we talk about it. So in order to break up tissue or actually physically change tissue with your hands, you really aren't structurally changing anything. Again, you're changing how the brain perceives things. You're altering the nervous system in the body. When I'm doing soft tissue on clients, I am not changing the muscle. I am not, if there is a knot, I am not ironing that knot out. What I am doing is applying pressure, which decreases, again, it changes how the brain perceives things, which decreases the tension and the contraction in the muscle. I'm not changing the muscle with my hands, I'm altering the chemical response in the muscle, which then causes the muscle to relax. There's no breaking up of tissue, there's no altering things, there's no moving things into alignment. It's changing how the brain perceives things. And so foam rolling basically does just that. It's not breaking up tissue adhesions, especially not like on your IT bands. In physical therapy school, we do cadaver dissection, and one of the helpful things about this is it helps you really understand how resilient the human body is and how hard it is to cut through certain structures. I am not going to go into details because most people don't like details, but basically the human body is really, really resilient and really, really strong. And as much as I like to think I'm strong, I am definitely not strong enough to change anything with my hands or my body weight in my body when it comes to that tissue. having observed multiple joint replacements and surgeries, the amount of force that they have to use is actually kind of scary in order to change things. So the fact that we think we're doing that when we're foam rolling, we're not. We're, again, just changing the local response at the tissue, which alters how the brain perceives things, which then the brain then sends a different output to the muscle. The muscle relaxes, things feel better. So it's 100% chemical and neurological. It's not structural in the muscle. So those are some common myths about foam rolling. I will say foam rolling can feel pretty good though when you're done, right? And there's nothing negative about it. I just think it's important to know what you're actually doing when you're foam rolling. And if you like foam rolling and it feels good, go ahead and foam roll away. But if you're foam rolling because you think you should, then go ahead and stop and just do dynamic movement, active stretching, a light jog instead, and you'll get the same results. So if you have questions, feel free to message me and have